The first thing I'll do is flex somebody's hip completely and then internally rotate. This is called a hip impingement test. Again, if somebody has interarticular hip pain, arthritis, or an acetabular labral tear, this will often be limited and painful. Then I'll have somebody come straight up, and I call this a flexion abduction test, and I'll have them do a circle like that. If somebody has iliopsoas tendinitis or a deep snapping hip, where that iliopsoas tendon snaps over the pectineal eminence, as she comes up and around, you'll feel a deep clunk, and that will often be painful or tender there over the iliopsoas. The next thing I'll do from this position, particularly if somebody has midline pain, is just palpate down until I hit the pubic symphysis, which is right here. And once I hit that symphysis, if somebody has osteitis pubis or an anterior pubic ramus stress fracture, which we'll see occasionally, when you palpate over the pubic symphysis and then the rami on both sides, you may get tenderness there. The other area that I like to assess when somebody's supine is their adductor tendon, and I'll have somebody get into like a half butterfly position and then just let their knee fall. And if someone has a bag groin strain, this by itself will be painful. Then from this position I'll have them push back, and again, if someone has a groin strain or an inferior pubic ramus stress fracture, that will be painful. And from this position too, you can have them push against your arm, and that makes that adductor tendon just pop right up, and then you can palpate that tendon right into its origin.